One of the series that I did was strange sensations, and many of the strange sensations that people have is caused by a malrotation of the C2 vertebrae. So you know I talk a lot about the top vertebrae, which is the atlas, but if you look at from the side, the C2 vertebrae is much, much bigger. And the reason for that is there's so many muscles that attach to it. And I often think that this C2 is even malrotated. See how it's malrotated to the one side? So the C2 vertebrae, or the axis as it's called, I feel is often the missing link into what's causing a person's symptoms. The nomenclature is, so this is C1, this is C2. So if C2 is rotated from the back to the right, we call that a right C2 rotation. So I'm going to just take this out. So in other words, if the C2 is rotated to the right from the back, the spinous process is to the right, we say that it's rotated right. And you'll see that it pooches out here. And when it pooches out there, it can obviously compress the carotid sheath. So you see that when it rotates to the right. When the C2 rotates to the right, the head goes to the left. So right now, my C2 is rotating to the right and I'm looking to the left. So imagine if a person's C2 vertebrae was kind of stuck, always kind of rotated to the right. Well, that's going to obstruct the carotid sheath. And we know that obstruction of the carotid sheath can cause a lot of symptoms. So this is what it looks like in x-ray. So you guys can just go get an open mouth view x-ray and you can see that this one, the C2 compared to the midline, is rotated to the left. Okay, so this is the dens. So here, I'll get this model out again. So if we look at here, see the dens right there in C2. So the dens is what your head rotates around. That's a bone, that's part of the axis or the C2 vertebrae. So when the spinous process of C2 is to the right of the dens, that's called a right C2 or a posterior C2, and that's going to compress the carotid sheath on the right side. And well, I'll just say here, see how this one, the spinous process is to the left. And then you could see where this is the atlas C1, this is C2 is to the left, and C3 is to the left. So a CT scanner, we do upright cone beam CT scan, can show which way the vertebrae are rotated. If the C2 rotates to the right, so if it rotates to the right, it's going to compress the carotid sheath on the right. So that's going to affect the right vagus nerve. So the right vagus nerve, that innervates the digestive tract, so that can cause all kinds of digestive tract symptoms, including bloating, nausea, irritable bowel, constipation, difficulty swallowing, things like that. When the C2 is rotated to the right, that's also going to affect the glossopharyngeal nerve, which is one of the nerves that innervates the muscles in the larynx for swallowing. So somebody could get difficulty swallowing. It's also going to affect the spinal accessory nerve on the right, and that gives you cramping into the sternocleidomastoid muscle or the trapezius muscle, and that can give you like torticollis. It can give you torticollis. As these muscles clamp down, the person might have a tremor, or they might want to rotate, like their head seems to rotate to the left more easily and they can't rotate to the right. So if you are somebody who, like, you can rotate your head easily this way or not the other way, that could be because of malrotated C2. Some people have it where they can go this way easy, but then this way they can't. That would again be a sign of a malrotated C2. But you can see that it can give you a lot of other symptoms. For instance, when the C2 is rotated to the right, it can obstruct the right jugular vein. Well, once it obstructs the right jugular vein, that can give you increased brain pressure. And then because of the increased pressure, any sort of brain symptom, anxiety, depression, personality changes, dissociation, things like that can occur. Obviously, you can get brain fatigue, dizziness, short-term memory can start to be a problem. It can affect the cranial nerves where you could get right trigeminal neuralgia. You could also get a metallic taste in the mouth. You can get a burning mouth. This is a picture of our skeleton that we have in the office here. And I stuck a metal rod in the jugular foramen. And you can see that the metal rod lies right in front of it, basically touches the atlas, which is C1, but also C2. So you could see that if this vertebrae was rotated toward this metal rod, it would absolutely constrict it. And the metal rod is basically where the internal jugular vein, the vagus nerve, the glossopharyngeal nerve, and the spinal accessory nerve travel. And then this just shows the carotid artery, and then this is the vagus nerve. So the vagus nerve and carotid artery, and the carotid artery also is in the carotid sheath, they travel right in front of the C2 vertebrae. This figure is from the back of the neck. It shows the muscles, the small muscles, the suboccipital muscles at the junction of the head and the neck. So tension on one side could be an indication that there's malrotation of the C2 vertebrae. Now it should also be noted that there's muscles in the front of the neck, like the longus capitis, the longus coli muscles that attach to C2. So again, rotation of a vertebrae can also affect the muscles in the front of the neck. So tension in the front of the neck can also be a sign that there's a C2 malrotated vertebrae. I just wanted to show this, that the vagus nerve, so what we do in the office here is we can see if the vagus nerve is under tension just by doing an ultrasound. So you see here where the vagus nerve is nice and round, and here see how it's elongated. So even though this person's internal jugular vein is open, the vagus nerve is under tension. And we have to remember, injury to the vagus nerve can affect so many things, because the vagus nerves, they innervate the heart, they slow heart rate down. So if the left vagus nerve is under tension and compression, it can cause tachycardia or postural orthostatic tachycardia syndrome. It can even cause arrhythmia. So somebody who has newly diagnosed atrial fibrillation, it can be from that. It can cause all kinds of anxiety states, various personality things. Decrease in vagus nerve activity is associated with a low heart rate variability. So anybody at home could monitor their vagal nerve function by monitoring heart rate variability, and I would really recommend that. People who have good vagus nerve functions, they tend to have lower pulse rates, feel very relaxed, peaceful, and they normally have very good health compared to people who don't. We do digital motion x-rays or motion x-rays to show that there's instability. So this person, with flexion, their C2 vertebrae moved 2.2 millimeters forward. This particular person had, basically because of that, their carotid artery was compressing their jugular vein, and it was even obstructing it completely, leading to intracranial hypertension. So these are other methods where you can tell if your jugular vein is compressed. We do ultrasound, but the standard test that's used in traditional medicine is CT venogram. So dye is injected into the vein. You can see there's constriction of the jugular veins at various locations. And you know from previous videos that I've made that internal jugular vein compression is very, very serious. It can cause eye pain, dizziness, anxiety, visual snow. blurry vision, distorted vision, after images, double vision, seasickness feeling or Mal-de-Barkman syndrome, unstable visual field. So imagine if you were looking at something and the image that you were looking at was moving. So people often say, well, I feel like seasick because everything's moving. And then depersonalization, brain fog, and ultimately it causes increased brain pressure, and increased brain pressure likely is the cause of short-term memory loss or dementia. So what's a person to do who has a C2 malrotation? Well, obviously there's a lot of different ways to get rid of pain, and a lot of people, what they do is they'll have tension up here and they'll get botulinum toxin injection, which I think isn't a good idea, especially when you have upper cervical instability. So people say, well, it relieves some of the muscle tension, but if you have cervical instability, when the ligaments are damaged, the muscles tighten to try to stabilize the area. So if you have cervical instability, weakening the muscles is going to make the problem worse. So because of cell phones, we're getting abnormal forces on the cervical spine, and this leads to upper cervical ligament damage and lower cervical ligament damage. Upper cervical ligament damage often leads to subluxation or malrotations of the atlas or the axis, and lower cervical ligament damage leads to a breakdown of the cervical curve, which I call cervical destructure. Ligament damage is treated by prolotherapy. Prolotherapy is an injection technique that stimulates the repair of damaged structures such as ligaments to thicken and tighten them to resolve upper and lower cervical instability. Vertebral adjustments are done for the malrotated vertebrae. Another reason for somebody to get an adjustment is if a chiropractor or physical therapist or somebody who's skilled with adjusting adjusts the vertebrae and the vertebrae get into proper alignment, if there's a remarkable improvement of the symptoms, like I just saw a patient from Canada, and they said whenever they get an atlas adjustment, it's unbelievable like how their head clears up, how the dizziness goes away, but then even on the drive home, it can go out of alignment, and then all of a sudden they get terrible symptoms. Well, for the person, they know the treatment they need is to resolve the atlas instability or the upper cervical instability, and thus they're here for prolotherapy. And then when there's a breakdown of the cervical curve, we do cervical curve corrections. Cervical curve correction starts with having the computer screen up so the body's in proper posture. I personally have a kneeling rocking chair. So kneeling rocking chair, because it's curved on the bottom and it can move, it forces me to contract my core and have proper alignment of my spine when I'm using the computer. Obviously using prism glasses to view a cell phone or have the cell phone up, or there's various tripods that a person can have and use the cell phone, again with proper alignment. Basically, somebody with C2 malrotation or even atlas malrotation should see if a vertebral adjustment has a significant positive effect. And if the person can't hold the alignment, then of course consider getting prolotherapy, and if the cervical curve is reversed, then doing cervical curve correction.